Right, hi, I'm Vicky Roy, speech-language pathologist and co-owner of Dynamic Therapy Specialist. Today I want to talk to you about ear infections and how they impact a child's ability to process what they are hearing. So in early development, our hearing system isn't already developed. It's something that develops in the first couple of years of life. And so what happens is that the sound comes in from the environment and into the ear and into the brain to be processed. If a child has reoccurring ear infections or simply just has chronic fluid in their ears, then what's going to happen to the sound is the sound has to travel through that fluid in order to get into the brain in order to be processed. And so what you want to happen in an ideal situation is sound is passing through the ears with no obstructions, getting into the brain, and you have a clear, crisp signal. However, with fluid in the ear, depending on how long that fluid is there, depending on if that fluid is infected, how thick the fluid is, the sound has to travel through that to get to the brain, which is going to result in a signal that is not as crisp as you would want it to be. And so we know that if you have a history of ear infections, it's not causing an auditory processing disorder. However, it increases the likelihood. And so in the absence of known ear infection, so think about this, when you have an ear infection, the fluid is in the ears and it's been sitting in there long enough for it to get infected. In the absence of a known ear infection, doesn't necessarily mean there was no fluid, it just means that it wasn't in there long enough to create an infection, to create some type of signal where the child would indicate. If your child has a high pain tolerance, if your child doesn't run a fever, doesn't pull on their ears, doesn't necessarily mean that there's not fluid in their ears. Oftentimes you go to the doctor for a well check and your doctor says, oh, look, your child's got fluid in the ears. And so a known history of ear infections tells us that we have a higher likelihood that your child's auditory processing system did not develop optimally. However, in the absence of a known history, we don't know whether or not there was fluid or not. So when we have a known history of ear infections, there is an increased likelihood that the processing system will not develop ideally. Why is that an issue? Well, auditory processing is something that develops over time. You have the ability to hear. The system is picking up the sounds. That's going to be measured through a hearing evaluation where the child is just going to hear beeps and they're either going to hear it or they're not going to hear it. Alternatively, what does the brain do with the information once it gets into the brain? That's the processing piece. So we've got the equipment. Does the equipment work? We're going to test that with beeps that get louder, that are at different frequencies. And then we've got, okay, well, what does the brain do with that sound once it gets into the brain? That's the auditory processing system. And when we have a known history of ear infections, we have an increased likelihood that the system didn't develop optimally. There might be difficulties with the ability to process that sound. If your child is struggling with their auditory processing, perhaps you're noticing that in noisy environments, they are struggling to really pay attention. Maybe they're having difficulty in the classroom. Maybe they're saying huh or what a lot, asking you to repeat things or having the teacher to repeat things. One of the things that you can do is you can go onto our website and you can complete our auditory processing screener. Another thing, at DTS, we have audiologists on staff who specialize in auditory processing, as well as our entire team of speech-language pathologists. And we are able to complete a comprehensive auditory processing evaluation, which would allow us to be able to objectively measure your child's auditory processing skills and to create a plan for remediation in order to be able to systematically improve that system.